Good morning and welcome to today's webcast. Capitalize on big data and analytics to predict portfolio growth, performance, and investment opportunities. Before we begin the presentation, I'm going to play a brief housekeeping video.
Moss Adams is pleased to present another in our ongoing series of continuing professional education webcasts. Our presentation will start in a few moments. Before we begin, here are a few things to keep in mind. You can customize both how you view our presentation and how you interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can also adjust window size and placement. At the bottom of your screen, you'll see a series of icons, each relating to a different aspect of our session. For example, you can click the file folder icon to download the group attendance sheet and a PDF copy of today's slides. You can ask our presenter questions during the webcast by clicking Q&A in the bottom left-hand portion of the icon bar and typing in your question. We'll do our best to answer all questions during the presentation or follow up via email. If you experience technical difficulty during today's presentation, refresh your browser by hitting the F5 key. We'll ask polling questions throughout today's presentation. Per the National Association of State Boards of Accountancy Webcast CPE standards, CPE credit will be awarded based on your participation in these polls. To respond to a poll, click the button next to your answer. If you're attending this webcast in a group, in order to receive CPE credit, you must complete our attendance sheet, available in the file folder icon at the bottom of your screen. Please have all group members sign the sheet, and please remit only one sheet per group. Also note, today's session will offer you 1 CPE credit. To receive credit, you must meet the requirements as specified by the National Association of State Boards of Accountancy. CPE credit can be awarded only to participants registered as themselves and is not available to participants who view the on-demand version. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon to open a PDF file you can save to your computer. We'll email a copy of your PDF certificate in 2 weeks if you can't download it today. As a reminder, the presentation you're about to see is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
Thank you all for joining us this morning, and I just wanted to let everyone know that we will be using a screen share during the presentation. To maximize your experience for the screen share portion, please use the arrow in the lower right corner to expand your slide view, or use the arrows in the top right to see the slides in full screen mode. Slides are also available to download from the Handouts widget to the left of the slide view. And with that, I will turn it over to Paul to get us started.
Thank you, Emily. Welcome, everyone. We appreciate you spending time with us this morning. My name is Paul Holden. I'm a senior manager in the Healthcare Consulting Group here at Moss Adams. I help co-lead our cost reimbursement practice, which encompasses Medicare and Medicaid consulting, but my involvement with cost reporting and other regulatory matters has led to a significant interest in big data and analytics, because analytics and IT solutions truly are where the industry is heading going forward. We've seen significant expansion in this space over the last 5 to 10 years with some of the big players in the market, but with the availability and speed at which claims data has been able to be accessed, we're seeing a lot of new opportunities in the middle market as well. To kick things off, I'd like to introduce our speakers this morning. Karl Rebay is a director in the Healthcare Consulting Group here at Moss Adams. Karl's been active in the field since 1994. Karl offers financial and operational consulting to healthcare clients. He leverages his deep expertise in provider operations and finance, strategic business planning, and capitation arrangements to assist hospitals, physician organizations, health plans, and management services organizations as they strive to succeed in the current environment. He has experience with service line assessments, turnarounds, feasibility studies, development of capitation models, and negotiation and analysis of managed care contracts. Prior to joining Moss Adams, Karl served in senior management positions in hospitals as well as physician organizations. Our co-presenter today is Jeff McDonald. Jeff is the CEO and founder of Expression Health Analytics. Jeff has over 20 years of experience in technology, innovation, and analytics. By providing insight to healthcare providers, he enables them to better understand and predict changes in the market in order to execute their vision with greater success. Before his passion for startups led him to found Expression Health, he spent years launching new businesses or leading strategy and growth at existing ones. Formerly as Senior Vice President of eVariant, he focused on product and platform innovation for healthcare customer management platforms and oversaw analytics data warehousing, predictive analytics, marketing automation, and claims-based physician referral solutions. He also served as National Director of Healthcare Market Innovation at Ricoh US Healthcare. So the goals of today's presentation will be to provide the group with a high-level industry update relative to expansion and investment. We're going to explore investment strategy and identify required core strengths and challenges. We're going to describe how analytics can be used to evaluate and predict market opportunities and performance, and we'll identify opportunities to drill into data to uncover real market opportunities. So to begin the presentation, we'll start with our first polling question. The question is, how informed do you feel about what is going on in the healthcare industry with respect to your market, competition, patient utilization patterns, and how is your organization ranking in the marketplace? Are you well informed, somewhat informed, or not informed? Give everybody just another second here. And the results. So somewhat mixed across the board. So it'll be interesting to see as the presentation evolves how folks feel about their positioning. So to start things off, I will pass it over to Karl.
Great. Thanks, Paul. And good morning, everybody. Thanks for joining us. I'll reiterate the gratitude to spend some time with you guys this morning. We're going to focus a little bit on what's going on in sort of the general marketplace and drill down a little bit into specifics, as Paul mentioned. You know, there's been a lot of discussion over the past really kind of decade about the impact of industry consolidation. You know, for those of us who've been in the industry for a long time, we know that the consolidation trend overall predated the Affordable Care Act. And, you know, the impact of the ACA or Obamacare has been to really intensify that as the uncertainties created by new laws and by the volatility in the regulatory environment has you know, sort of forced organizations to rethink their strategies. And so, again, a lot of discussion about consolidation and, you know, whether the impacts are positive or negative. Certainly you see things in all industries that experience the type of consolidation that we've been experiencing, impacts on pricing. We focus a little further, pricing and market power. We focus a little further on the impact related to quality just by nature of the fact that healthcare is what it is. One of the other interesting phenomenon has been that private money has, private equity and venture capital and such, has really acquired a taste for healthcare, and you know, from our perspective and in my experience, is bringing much needed business savvy to the industry. You know, we've sort of muddled along over many decades and gotten ourselves into a situation where the pricing of healthcare services has, you know, created an unsustainable situation, and that, you know, led to significant funding coming out of the federal government, which in turn led to politicians, the political machine getting involved. And so, frankly, the trajectory we were on made it inevitable. In any event, one of the nice byproducts of what's been going on is, again, that business savvy, that sophistication level that a lot of private equity organizations and related investors bring to the industry. The regulatory environment is clearly there's incredible volatility. I mean, we can't click on a news webpage or pick up a newspaper, if anybody's doing that anymore, and not read something about politics and healthcare. And so we kind of consider the environment in healthcare to be a little bit unique in that, you know, there is the debate about whether or not healthcare is a right or a privilege. You know, we've got laws like EMTALA that provide for service provision in emergency room situations that sort of ignore the business aspect. And so in a sort of a market-based industry, or at least an industry that's been historically market-based, we have a lot of complexity, and that has served to create different directions in terms of strategy, different things that organizations need to be thinking about. But dealing with situations like privacy considerations and clinical quality issues, again, pricing in terms of what the role the federal and state governments play, it all creates a very complex situation. And then, of course, we have the recent political and regulatory governmental changes to the Affordable Care Act and the uncertainty that's caused by that all create kind of an interesting situation. Of particular interest to many are opportunities related to the outpatient space. So we've got technology and we've got innovation and enhancements on the clinical side of things that create more business in the outpatient setting. That type of innovation gets different folks involved in the industry just by virtue of the fact that they create new opportunities. So we've got pricing pressures that are driving change. We've got this migration to different clinical settings. We've got a lot of different business models out there, and really a recognition of the opportunity. And we know that the deal and investment dollars, whether they're internal or external, private or existing healthcare organizations, has ebbed and flowed with various times throughout the past decade, I'll say, because of a lot of this change. There has been a clear recognition that there's opportunity there and a lot of interest in the sector. In terms of the provider side of things, for physician organizations and physicians in particular, life still isn't easy. The regulatory environment and health plan consolidation, those trends are really only making things more challenging for the physician community. And it's in a situation where physicians are already sick of dealing with the business side of things. So we hear about looming physician shortages. We hear and read about surveys where physicians are saying that they would not encourage their own children to get into medicine. The business side of things has become very, very challenging over time, and that's something that still is very real. And certainly, as organizations, they don't necessarily have the financial wherewithal to affect change and deal with a lot of the changes that they're having to deal with. On the hospital side, you've got, I would say equal complexity. In particular, provider employment and affiliations with providers is very, very challenging, and states with corporate practice of medicine prohibitions make things even harder. The question in business is naturally, how do I get more control over my pipeline? How do I drive more business to my organization? And it's very, very hard in healthcare, and particularly for hospitals. And then in terms of the other organizations that are out there, and we kind of, in the industry, we kind of lump folks together and call, sort of calling them ancillary services. There are many other provider types too, and we don't mean to leave anybody out. But the issues are very much the same, although in that other space, you tend to have a lot more fragmentation. There are more organizations. There's generally a lot less sort of coordination, and that's created a lot of opportunity for gaining control of segments and creating more efficient and effective models. Delivery of care, profitability, all of those things that are opportunities for organizations looking to get involved in the industry or enhance their position. As far as the payers go, another very important constituent in the industry, in some markets we're actually seeing health plan startups, organizations that are taking on different sort of roles within the industry. And in one particular example are hospital organizations that maybe have experience with capitation that are starting up health plans and taking risk from the health plans through various contractual relationships. That's one example of something that we're seeing clearly quite often on the coasts. But any organizations, there are a lot of different types that bear risk, are effectively acting like health plans. And by bearing risk, we mean capitation, we mean accountable care organizations, IPAs, independent practice associations that put together networks and then take premium dollars from health plans and have to live within those premium dollars and run their business and take care of folks. So there are a lot of different organizations that have to now act like health plans just because of the nature of their business model. And on the payer side, they're also dealing with pricing pressures. It's no secret that health plans, what they're charging employers and individuals and the government for coverage of individuals is, the premiums have risen dramatically and continued to rise. Over time, we've seen ebbs and flows, again, even with those pricing models or the actual pricing, but there's a very strong pressure, downward pressure towards health plan pricing, and those organizations are responsible for putting together networks of providers, and if they can't successfully contract with providers for better costs, they either get out of the business or get out of a particular marketplace, or they pass the cost directly onto those of us who are buying insurance. And that's what we're seeing with the healthcare exchanges and marketplaces, is that the health plans have had to deal with bringing pricing down and at the same time contract with providers and provider networks, and sometimes the financials just don't balance out, and that's what we're seeing a little bit of there. And then certainly on the, just consumerism overall related to health plans, it's still a very big deal. Again, contracting with networks, selling insurance, you can sort of see that they play a bit of a middleman role. And again, there's that balance that you've got to strike, and sometimes it doesn't always work. So a lot of challenges on that side of the industry as well. So Paul, I think we're going to jump into our second polling question.
Very good. Our next polling question is, does your organization act like a health plan, for instance, taking downside risk like capitation, bundled payments, premiums, etc.? Yes? No? I don't know. Give folks just another second here. And the results. All right, Karl, back to you.
Yeah, thanks, Paul. And these are, when I look at the top two lines here in terms of the responses, that's very common in terms of what we see. We sometimes with some of our audiences we'll see a greater proportion of those indicating yes, but we appreciate that we've got a lot of different organizational types here, and it's always good to know. There are a lot of different forms of this, as I mentioned, ACOs and things that are taking different or taking different holds in different markets, different levels of participation, and contracting strategies that drive those figures and drive those strategies. So just distilling this into impacts in terms of the investor markets. When we think of investors in the healthcare space, certainly we are focused on equity investments, but also on organizations that are investing and expanding in a more traditional sense. And those organizations really all together deal with a lot of different, a lot of the same types of concerns and issues. And we're going to talk about some of those here. We've already talked about the uncertainty and the volatility in the healthcare space overall. But for healthcare investors, really there's so much going on. At a macro level, you could make the argument if you're on the outside looking in, contemplating investing in the healthcare space, there's always going to be a need for these services. It's never going to go away. On the other hand, the volatility is significant, not the least of which, in terms of reasons, is the regulatory environment and how are things shifting. How strong is the marketplace for the private sector, for the private side, and how much regulatory change will continue to come, and is it going to migrate more towards more regulation or less regulation? And I think the the smart money's on that the regulatory environment will continue to get more challenging. But that doesn't mean that there isn't significant opportunity there. So again, and we've also talked about the impact of consolidation on the other components of the marketplace. What we're seeing nationally, and this has been going on for some time, are that there are particular specialty types and niches within the healthcare industry that have seen a lot of consolidation driven by private equity investment. And you can look at the types of organizations, and we just list a few here on the slide: physical therapy, urgent care, ASCs, retail medicine, and there are so many more. Home health is something that we've seen some traction in. And those organizations are going around the country or going around in particular regions of the country and making acquisitions and driving consolidation and looking for efficiency, looking for profitability enhancement, those things that investors typically want. We have our personal experiences in a lot of different markets, and we're seeing our clients contemplating different things, different strategies in some more traditional and then, of course, less traditional avenues. But what you seek are the same types of things in healthcare as you do in other industries. We want enhanced market penetration, which brings with it market power and hopefully revenue enhancement, and then enhanced efficiency. And that's where a lot of people see opportunity in healthcare, is on the efficiency side of things. So we know, there are a lot of different publications, a lot of different statistics out there in terms of how much money is on the sidelines. That number that we show here, I think that might even actually be a little bit dated. We've seen other figures higher than that, but that number tends to ebb and flow, and there's speculation all over the place. I think the point we're trying to make here is that there's a lot of interest in the healthcare space, and there seems to be quite a bit of money out there in terms of organizations looking to invest. And so when we think about what those folks are looking for, we can talk about volume, and we know in 2016 that the volume and deal value overall ebbed quite a bit from the prior year, but that doesn't mean that there isn't significant opportunity out there. And when we think about those opportunities, we focus on those more fragmented outpatient markets, at least in terms of what we're seeing, and the sort of the biggest bang for the buck. One comment quickly on the point that we make here about the need to close deals quickly, that sort of is driven by the competition that's out there that we're seeing. So maybe the deal volume is down, and maybe that's driven by perceptions about opportunity, but we also know that organizations are getting more sophisticated in the space, and what has not traditionally been there is the analytics capability associated with closing a quicker deal, whether it's part of due diligence or otherwise, and we're going to talk a little more about that. But the point there is the need to close deals quickly comes from a lot of different reasons. One is organizations are trying to explore a lot of deals and make acquisitions and get their market share, which seems to be the most important driver. So migrating the conversation a little bit into what those challenges kind of look like in terms of identifying deals, developing strategy, closing deals, or making other investments and performing the analytics on those investments. The first thing, of course, organizations need to do is develop their strategy, and that isn't so much to answer the question of why do this, because when organizations get to the point where they're contemplating investments, they've already figured that out. The real question is how are we going to analyze an opportunity, and how are we going to make it successful? And those are really the key questions that we're wanting to talk about today. Identifying legitimate opportunities, figuring out how to get to where it is you want to get, the targets that have been laid out in a particular strategy. So, we think about the traditional types of analytics and contemplation that goes into investment decisions, and you can roll that all up into what we call due diligence. But at the end of the day, in our particular industry, there are inherent challenges that are maybe a little more significant in terms of analyzing the demand side than occur in other industries. I've been involved with a couple different organizations prior to joining Moss Adams. One in particular was a hospital company, and we had private equity owners, and they were fairly new to the healthcare space, had cut their teeth in real estate, which made for an interesting and very logical transition into hospital ownership. And I remember we were going out to an event with one of the owners, and my boss at the time looked over at one of the gentlemen who was one of the equity investors and claimed to him, "This ain't making Barbie dolls," is the expression he chose to use. And it's a fitting comparison. It's not manufacturing anything, and the business model itself is one of the most challenging, certainly, of any industry. And so when you think about what has to be done to figure out an opportunity, and due diligence in particular, the typical retrospective nature of due diligence, I'm not saying that it's always the case, but very often it's the case that organizations are looking at historical performance and then making some very broad assumptions about what might happen in the future, without doing very detailed business intelligence analytics that are going to really answer the question specifically about what the opportunity looks like. So I think at this point I was going to ask my presenter colleague here, Jeff, to jump in and comment on due diligence and then continue on with the presentation from here.
Sure. Thanks, Karl. I think one of the things that I've found, I'm kind of come from a unique background, kind of bringing lean manufacturing into the mix, is I hate doing anything twice, especially if I can't get it right the second time or the third time. So when we talk about diligence, generally what we always think about is not the questions to be asked, but what is the ultimate answer that we would want to have, and the confidence specifically in that answer. We see so often in a lot of the organizations we've dealt with over the years, some of the corporations I've worked for way back in my past, is we get to a place where close enough is measured based upon some, what I would say might have something to do with someone's ego. The deal's got to go through because I want it to go through. Sometimes trumps the quality or confidence in the business plan going forward, and also sometimes even what I would say the leadership's capacity to continue to operate a company after an acquisition may occur, as an example. So what we try to do in analytics is to define those things that can be binary, highly confident yes or no, the questions that are within what we use the term a stochastic model, within a range of variation, and then those things that there can be open-ended enough in the diligence process where the only thing that's going to answer it is relationship. So if we can look at every transaction, every opportunity for growth, innovation, if you will, in the business model from a revenue perspective, we always want to try to see where we can eliminate those things that can be mathematics, pre-computed, and then subsequently with degrees of confidence on that information. So what we're talking about today is how can that be done via analytics, specifically leveraging big data. Big data is a term that's thrown around a lot, but it specifically has to do with an ability to handle high volume, veracity, changing data, and glean nuggets of information out of it that can be turned into answers. So we try to make sure we break those answers down into those three things. Are they binary, yes or no? Are they within a range of confidence? Or third, do they require some kind of human intervention to validate either leadership, direction, strategy might be missing some things? Sound good, Karl?
Absolutely.
So from there, we kind of look at a few big things that we're specifically going to talk about. In the concept of portfolio management, often the questions are whether you're private equity backed, if you have private equity money in your business today, or you represent a private equity organization, there's always a few very critical things. First and foremost is when capital is being put to use for acquisition, who? Second, where geographically, and there's a lot of information about geographics in healthcare, reimbursement rates, market consolidation rates that were referenced before. Those are critical to evaluating the who, but also which specific sectors. So when we look at the sectors, obviously healthcare as a provider market can be broken up, as Karl referred to before, home health, skilled nursing, what we classify as the post-acute space, The retail health space, urgent care, outpatient clinics that are very much standalone, small therapy clinics. Each of these sectors has a variety of opportunity to influence other sectors, both in cost and quality. There's quite a bit of arbitrage that's available economically in the spaces that are highly fragmented. The other area is the portfolio itself. What adjacent companies that you could potentially tuck into an existing portfolio would drive the greatest amount of realized value? How do they help what I'd say is sometimes a second or third stage of a business growth model? As an example, if you do mergers and acquisitions as the foundation for a portfolio, a lot of time keeping and sustaining the same store sales and or adding new retail locations can be a tremendous second or third phase to the growth of that business. Some of the sectors that we've seen the most activity in is really in this in the outpatient space around dermatology. Dental care is something that recently we've been asked quite a bit about. Pain management, without a doubt, is huge because of reimbursement. But one of the areas that's also huge is it has to do with what's happening to hospitals because of the debt, is the shift from inpatient, and it's an erosion to surgery centers. It's a capture instead of at the emergency department to an urgent care center because of convenience. Areas that are consolidating incredibly rapidly, specifically physical therapy is one we spend a lot of time in. We'll be using some examples to show the application of analytics in. And that is, there's a couple reasons. One is how fragmented it's been, but also, I believe, truly the long-term impact it has on total cost of care and quality. So there's kind of two forms of arbitrage in play with physical therapy. The other area is, the hospital employment, the acquisition of physician groups, bringing them into the organization to kind of control clinical pathway for quality, but also for the purpose of really making sure that there is a strong referral and surgical alignment. Urgent care sector is exciting and is very much more like a retail approach. Looking for drive times and traffic patterns can be incredibly important. But urgent care has some tremendous expansion potential because of the fact it can be a tremendous source for patients that have higher severity and acuity to be directed to optimal care plans, like specifically surgical references or surgeries, as the case may be. So they have tremendous value in the overall scheme of the healthcare ecosystem. And then specifically looking at practice management and the revenue cycle side in areas like oncology, because of the complexity of billing practices and the variation of care that exists. These are all incredible opportunities that I would say a week doesn't go by that one or two or possibly three or more come our way where people are looking for information. Now, when we think about, and Karl, you referenced this before, and it's so critical. I'd like you to comment as well on this one. But I remember years ago I read a book by Jack Welch, and he spoke to the velocity of capital, and the quicker that was pretty much referencing like supply chain activity. How do you turn your inventory? But right. Also in the decision-making process for acquisition, I think this is an area where folks need to understand that the right acquisition, right time allows you to put capital to work to run a strategy, to execute operationally on either that cost or quality arbitrage that is really necessary to fix a lot of the challenges in healthcare. So I don't know if you wanted to make a comment on this one. I know we've spoken quite a bit about it.
Yeah, it's a great point you make, and the concept there of learning about whether it's a market or any whatever the investment is, learning about what drives that investment and makes it successful. It's the same information that's going to make you successful going forward. So it's not like you put the pedal down and you understand a market and develop a plan and then just go execute that plan without paying attention to what's going on around you. So that need for immediate information, real-time information on the marketplace and on what's going on around you is critical.
Absolutely. So obviously that then leads right to, what is the underlying information that's necessary to really truly understand the velocity. And you mentioned a term before, retrospective analytics. So we look at books, we look at financials. The one benefit in healthcare, because of claims transactions, because of other data sources published from CMS, cost reporting data, there's an incredible ability to use that historical data to evaluate markets, market competition. The challenge for most people is it's been old. Data's anywhere from 1.5 to 3, 5 years old in some cases. In some states have variations in availability. But the biggest thing is that timeliness, how recent that data is, has a lot to do with the confidence you can build upon that data. So if I have a data source that is 1.5 old, market conditions can change dramatically in 1.5 years. And hence, this is where a technology that enables rapid ingestion and analysis, which is the principles of big data, allows to change that paradigm. For the most part, people haven't been able to analyze the U.S. healthcare data sets in common databases because they're hundreds of terabytes. We're talking machines that small organizations would have to spend hundreds of thousands of dollars of infrastructure costs, never mind licensing, just to store and analyze that data. Well, what we know is that when you start to think about that, especially in a roll-up or a small business that's looking to grow, a lot of them don't have that extra cash on hand or capital to be able to invest in that data and answer those questions. Nor could they possibly hire or retain the skilled resources to do that type of analytic. So this is where data starts to meet the business need in the changing times of capital. So when we begin to look at things differently going forward, we have to think about what the cloud is doing and how we can use cloud-based analytics, which is real-time available without having to host systems. But really what that then does is give an ability to analyze things like the real estate and the real opportunity, like the geographic and the perceived versus the real. This is where we get rid of personnel or personal perspectives and begin to see what does the data tell us about a market. And then ultimately, I use the term EBITDA because we have a lot of private equity-backed organizations that we work with, and they're focused on how can I improve valuation in that portfolio as possible? What are my levers? And how can I possibly move those needles faster? So the biggest areas that we continue to look at across the healthcare sectors is new business opportunities. And those, again, I go back to, is it the geographic opportunity? Is it the acquisition opportunity? Is it just what I'll call the physician alignment? Do I need to make sure people know that I'm in the market providing a service as an organization trying to grow? And that's really what those levers are. How can I use those three things while understanding the trends to then do the right things within my portfolio to create the impact I'm looking for? And how does the activity of a competitor potentially in the market affect my confidence and my ability to forecast my growth, my trajectory from a given strategy? And the big area here is that the faster or more complete this due diligence is, the quicker confidence in a management or leadership team can be to either staff up or acquire someone that has the staff to take over that opportunity. These are all, again, these are just levers, and data provides that foundation to make sure that we can execute. Because there's timing in the business where if we have the right opportunity but we lack the people, so it's the right financial opportunity but we lack the leadership team to go operationalize and execute, it still isn't the right opportunity. So this is where doing what-if analysis on data is incredibly powerful. And then ultimately, what does that lead to? It leads to opportunities around branding and changing your market message. And this is a principle of an innovation framework called renewal innovation that is so critical. If you have opportunities but you don't necessarily get your brand messaging right, it doesn't mean you're necessarily going to reach your stated objectives earlier on. So we always look at markets, and this is an area for folks that work in analytics all the time. We kind of take this for granted, but a lot of times in healthcare, the folks that we're working with have heard analytics, but they don't necessarily understand the differences between the two, or the three different sectors of analytics. So descriptive analytics is who is how big, what market share do they have, and I always use this term, who's who in the zoo. The second is predictive. Based upon all those things and the current trends, what would happen over the next 3, 6, 9 months if all things moved according to the plan that's currently going on in the market, which we know doesn't always happen. But then the third, and one of the most important opportunities, is the prescriptive. And the prescriptive is, I see all these things, I see what's happening, but what should I do about it? In some cases, that means don't make that offer. Open in a different market that has a better reimbursement or potentially has different regulatory activities that could be more beneficial to your business model. So this is the power of data science and big data to give you the ability to do this, what we call what-if analysis, rapid modeling and assessment of the various conditions that are around you. An area that has been really important, and Karl, you and I have done this with several clients over the years, it's really about if we could sit down with anyone on this phone today, there's always a few very critical questions that need to be answered. And often when we look at data and we look at analytics, the challenge is you can get analysis paralysis. But really, if you pick the questions that if you had the answers to, it would change how quickly you could move, what would the answers need to be? We've developed this method of story mapping because it really helps people to understand if they had these questions first, and you can look at this list and pick yourself, and then we had these second answers next, we could at least get started and run some things in our business in parallel. So we could look at our next 90 days, the following 90 days, 180 to 365, and understand what we can do in tranches. We don't have to try to eat the whole elephant. We can take answers and begin to put them to work in businesses. I would say this is probably one of the biggest misses in healthcare, is that folks think they need to have all the answers once they start using analytics, and that's an area of difficulty you'll run into if you try to think that you'd get all the lights green on the way. Thank you. Looking at the next one. Here's questions for everyone here. What do we know about utilization patterns in the market? So for anyone here that's running or operating a business today, what do you know about the utilization patterns? What kinds of things do you know about the physicians in your market, whether they're your own physicians or your competitors? Do you know where they're doing procedures? Do you know what mix they do, inpatient versus outpatient? What types of clinical procedures are most dominant, and how does that compare to some of the changes with value-based care? And how powerful would it be to really begin to understand what services are underserved in your market? These are critical things that I think every organization needs to start putting out in front of themselves as a place to move towards, because sometimes we hear organizations that are trying to build services that are already overserved, and their capital's not going to return at the same level.
Yeah, that's something that we see all the time. It's absolutely about asking the right questions, but understanding these types of things. I mean, this is really where the speculation comes in. You know, you can have a large health system in a marketplace that has great intelligence on that particular market just by virtue of who they are and what they do. But there are a lot of ancillary and peripheral businesses out there, and a lot of those that we're talking about that have no ability to access this kind of analysis, and so they speculate. And you know, what do? You go and you interview potential business partners, physicians, plans, groups, depending on what service you're looking at or what investment you're looking at. But it's hard to know, and if you were able to really understand those utilization patterns and figure out who was going where and for what, that really takes a lot of the questions away and helps you make a very sound decision on what you should be investing in, or perhaps markets you should pass up on.
You have a poll question there, Karl?
Very good. Our next poll question. Does your organization currently purchase analytics services from some type of provider? Yes, no, I don't know. Give everyone just another second here. All right, almost 50-50. Jeff, back to you.
Sure. So what we're going to do is kind of teeing up a few things to share some ideas, but really what we're looking at is three primary levers. Shifting market share is one of the foundational principles for growth. How do we increase same-store sales in that model? Increase utilization patterns, so there's services that might be currently underserved. How do we staff them? How do we potentially build a new site to give better access to a group of patients that don't get certain services in the market? And then the last one is accelerating growth via acquisition. And the organic growth is the principle of de novo site selection. So you can take those three, kind of mingle them together, and you get different performance characteristics. So this is such an important part of understanding what's possible. And from that art of the possible to being able to do that specifically with data takes a lot of understanding of the challenges that come along with data. 80%, 90% of what we do as an analytics provider is really fix the data that comes out of various healthcare systems across the country. So it's always going to start with a foundation, these descriptive analytics, existing volume, degrees of market consolidation. So we're going to talk about the Herfindahl-Hirschman index, which is kind of a rate of which things are consolidating or how far they've already gone in consolidation. What's the relative market size? What's the payer reimbursement mix look like? How do referrals currently create dynamics in a given market? So if a hospital owns large groups, et cetera, how do they change the patterns? What's the potential volume from the trends that are going on in the market? Growth of population, people moving in or out of a market. How do access points, convenience, retail, affect the volumes and or the completion of service delivery? So different services have a requirement that people finish a service, a therapy, so forth. And then leakage or missed opportunities or erosion, the movement from inpatient to outpatient. These are all the descriptives. And then the predictives and the prescriptives. So I'm going to just take you all through some examples specifically with what we'll call a demonstration of capabilities. And I'm going to try to do this very simply, not try to answer all the questions that exist in the market today, but at least give an understanding of the possibilities. So just waiting for that full screen. So I've just selected a couple markets across the U.S. And what I'd like to share here is some principles of what we call visual data discovery. Some folks like tabular data, other folks are very visual like myself, where we would like to see patterns. So what we're actually sharing with you today is just an understanding of looking at different markets across the U.S. for market selection. I'm just going to hover over Seattle, Tacoma. And we're actually looking at a business model that has to do with specific outpatient services. And we want to see, from an axis perspective, the x-axis is the population growth rate. The y-axis is this Herfindahl-Hirschman index, or the consolidation that exists in a given market. And the idea here from a visual perspective is you see there's still opportunity for consolidation. That's why they're to the left of the market. So that means there's more arbitrage. There's more opportunity to consolidate, get some reimbursement opportunity, or get a good growth rate for that particular business. But now you also have the ability to see geographically the access points, to see how they might plot, and this is an acquisition scatter plot based upon an organization's criteria. They want more than a certain number of clinics or more than a certain amount of visit volume in the market. This is an example of answering those questions and providing the visual cues that allow business leaders and not analysts, not necessarily data scientists, but business leaders look at something and say, wow, that really makes sense. That's logical. I understand what's going on in that market, and now I can respond and not have to kind of wait to understand, well, what else is going on. And the power of analytics allows me to compare markets across the country and see them similarly. so we can begin to say, well, if we were to compare how we've done in Seattle versus what we'd like to do down in Scottsdale, the power is we can very quickly select, analyze, drill in, evaluate a specific organization, and determine, again, what the opportunity is in the portfolio, either to complement existing footprint or to extend footprint to create that, tier 2 and tier 3 growth strategy. Karl, any questions on this one?
Just to jump in, this is for everyone. This is the type of analysis that we're talking about. Really, when you think about what it is that you're trying to accomplish by investing in something, I've been doing and involved in decision support somehow, some way or another in my entire career, as many of us have. And the ability to do this has been hampered by lots of different things, the most important of which is lack of capability in terms of acquiring the market intelligence, the data, and pulling it together and doing a logical analysis of it, understanding what the right questions are, and getting to a situation where you're making decisions that will go beyond, you can make decisions that will, in large part, carry you beyond those unknowns and take away the vast majority of the risk of deal making that's associated with the unknown. And in healthcare, risk has been huge. So this type of analysis is exactly where we're headed in terms of sophistication in the healthcare industry, and the ability for organizations to make smart decisions based on information versus speculation.
Yeah, that's a great point. So I'm just going to point out specifically in this case, I referred to the answers to questions. We all have used Excel. Well, maybe not everyone on the call is an Excel expert, but we've all used tools like Excel on our desktop to build calculators. My favorite function I learned early on in the 90s was goal seek, right? How do I make the number fit my desired outcome? Well, the power of doing that across, in this particular case, 10 or 11 billion transactions. That's really what you're looking at when you're seeing the screen. It's kind of amazing. But how do I look at it and then give a business user the ability to say, well, no, my capital investment to open that new store is $195,000, not $225,000. And my weighted cost of capital is 6%. I'm expecting from a clinical conversion 11 visits per new. These are all those business pro forma type scenarios that someone would want to see. And what we've seen over the past 10 years, especially in my tech career, is now we have an ability to do these types of things at scale that weren't available even 5 years ago. To do this on billions of transactions, again, would have been almost inconceivable. But we have an ability now to evaluate a zip code from its future value and understand specifically, what's going on in that particular market around Redmond. Who are the physicians that are most prone to refer to a given entity based upon Bayes' theorem or some other statistical method that's been used inside these models. Again, answers to questions, where do I put my capital work anywhere in the country, build once, reuse for a portfolio. That's the intention here. So again, just leverage the principles of innovation to not have to do anything twice. And then from what's a classic last growth engine that most people look for is when you begin to look at a market, you think about same-store sales, and that's that referral development concept. How do I make sure I'm getting my fair share of referrals from a physician? And rather than have individual business users have to sift through Excel spreadsheets or be in a CRM and try to guess at what's going on, why not give answers? And it's changing the dynamic of portfolio management and investment strategy in healthcare. So, Karl, I just wanted to give everyone kind of a view of the what if and the possibility of analytics. So, questions? Yeah,
no, that's really great. And for the audience, if you end up downloading the slides, we've got just some sample screenshots in there, so you can refer back to some of these examples. Obviously, this is a separate video or separate interactive presentation we're providing here, but and if anybody has any questions, they can email in or contact afterwards. So I think we wanted to jump to what is our next polling question, if we're ready for that, which I think will be our last one.
Very good. Thank you, Karl.
Yep.
So our final polling question: is your organization currently considering an acquisition or expansion in the healthcare sector? Yes, no, I don't know. A few more seconds here. All right, an even split. Karl, kick this back to you.
Great, thanks, Paul. Yeah, and on that note, this is something that's very very typical when we're having discussions with folks. About half of the organizations that we're working with and talking to are contemplating some sort of an expansion or acquisition, and that might be just more depth in a particular marketplace, not necessarily geographic, but we definitely see both. So thanks to everyone for participation in that poll. We're gonna sort of wrap things up here, and I wanted to close with some key takeaways, and then I'm not sure if we'll have time for some Q&A, but you can send questions in now through this system or at any time. But just to sort of pull all this together, clearly, development of strategy and contemplation of strategy is key to all of this. Adequate planning, it's important. Having something concrete to execute on, having those clear goals, all those important elements of a strategic plan, of a strategy, are sort of what are going to be the overarching guide to what you're doing. We talked about speed, and in the form that we're contemplating here, this is about getting the right information quickly and being able to act on that information. And all things being equal, faster in this regard is better. So if you can assume that you can cut out months of research and analysis and do something and get to the bottom line of a particular market opportunity quickly, that's a very, very positive thing. Having capital, obviously that's key to this, but what we're talking about here is maximizing the value of that capital. So organizations as investors this is the ultimate question is, what kind of return am I going to get? And taking risk out of the acquisition process and expansion process is really what we're talking about here. So maximizing the value of capital. And then the last point we mentioned knowledge. This is really the crux of our presentation. It's what we're saying here is that knowledge, business intelligence based on real, timely market data is critical success. This is the differentiator. This is what's going to give organizations a competitive advantage. And, this is why we get fired up about the, sort of modern day capabilities in the marketplace, the ability to use real information to make decisions and make good decisions and important ones for organizations. So those are the takeaways that we have for you all. And just on a personal note, grateful again for your time. We're going to hand it over to Emily here at this point, and we'll get things wrapped up.
Great. Thank you, Karl. So if you had any questions today, we have run out of time, unfortunately, but definitely feel free to still ask questions in the Q&A window, and we can follow up with you after the presentation. And thank you again, Karl, Jeff, and Paul, for a great presentation. I also wanted to put in a quick plug for our upcoming healthcare conference. You can read more about that on the slide here, and we have a link to the conference website in the slide deck and handouts widget to the left of your slides. And as a reminder, if you attended today's presentation in a group and would like to receive CPE credit, you must complete the group attendance sheet found in the slide deck and handouts widget to the left of your slide view. If you participated as an individual and met all certification requirements, your certificate is available to download now in the CPE progress window to the right of the slide view. I'll keep the webcast console open for a few minutes to give you time to download your certificate now, and a copy of your certificate will also be emailed within two weeks should you have any difficulty downloading it now. Here is a link to an online survey where you can provide feedback for today's presentation. Please take a moment to complete this survey as your feedback is very important to us. And thank you all for joining us, and we hope you'll join us again next time.